General constitutional symptoms reflect systemic inflammation and immune activation. Common signs include fatigue, low-grade fever, weight loss, and malaise. For example, a patient with early lupus or mixed connective tissue disease may present with vague fatigue and low-grade fever before any organ-specific signs appear. Musculoskeletal involvement happens because autoimmune attack on synovium, tendons, and muscles is common. Features include joint pain, swelling, stiffness, morning stiffness similar to rheumatoid arthritis, and proximal muscle weakness. Examples: rheumatoid arthritis presents with symmetrical polyarthritis of MCPs and PIPs with more than 1 hour morning stiffness. Dermatomyositis presents with difficulty climbing stairs or combing hair due to proximal myopathy. Lupus shows non-erosive arthritis with joint tenderness but preserved joint architecture. Skin and mucous membrane manifestations occur when autoantibodies and immune complexes target the skin and mucosa. Features include photosensitivity, malar rash in lupus, skin tightening and scleroderma, Raynaud's phenomenon, and oral ulcers. Examples: lupus presents with a butterfly-shaped rash over cheeks, sparing nasolabial folds. Scleroderma presents with shiny, tight skin over fingers, called sclerodactyly. Sjogren's presents with dry mouth, oral ulcers, and rampant dental caries. Vascular involvement is due to small and medium vessel inflammation or vasospasm. Features include Raynaud's phenomenon and vasculitis causing skin ulcers and purpura. Examples: Raynaud's in systemic sclerosis or mixed connective tissue disease shows triphasic color change, white for ischemia, blue for cyanosis, and red for reperfusion. Lupus vasculitis presents with palpable purpura or digital infarcts due to immune complex deposition. Pulmonary involvement arises from autoimmune inflammation of alveoli, interstitium, or pulmonary vessels. Features include interstitial lung disease, pulmonary hypertension, dyspnea, and dry cough. Examples: systemic sclerosis shows NSIP pattern, interstitial lung disease, and pulmonary hypertension due to vascular remodeling. Antisynthetase syndrome presents with interstitial lung disease, mechanics hands, and myositis. Renal involvement occurs because of immune complex deposition or vascular injury. Features include proteinuria, hematuria, and hypertension. Examples: lupus nephritis presents with red blood cell casts, proteinuria, and elevated creatinine. Scleroderma renal crisis presents with sudden onset malignant hypertension and microangiopathy. Cardiac involvement occurs due to serosal inflammation or myocardial infiltration. Features include pericarditis, myocarditis, and arrhythmias. Examples: lupus pericarditis presents with sharp chest pain relieved by leaning forward. Rheumatoid arthritis may cause pericardial effusion or conduction abnormalities. Neurological involvement occurs due to autoimmune attack on central or peripheral nervous system structures. Features include seizures, psychosis, and peripheral neuropathy. Examples: lupus may cause neuropsychiatric lupus with cognitive dysfunction or seizures. Sjogren's syndrome may present with sensory neuropathy due to dorsal root ganglionitis. Hematological and immunological features arise due to bone marrow suppression, autoantibodies, or hypercoagulability. Features include anemia, leukopenia, thrombocytopenia, and antiphospholipid syndrome. Examples: lupus may cause Coombs-positive hemolytic anemia and thrombocytopenia. Antiphospholipid syndrome presents with recurrent miscarriages, deep vein thrombosis, and livedoreticularis. Differentiating clues by disease: lupus presents with malar rash, nephritis, arthritis, and photosensitivity. Systemic sclerosis shows skin tightening, Raynaud's, esophageal dysmotility, and interstitial lung disease. Dermatomyositis shows proximal weakness, heliotrope rash, and Gottron's papules. Rheumatoid arthritis presents with symmetrical small joint arthritis and morning stiffness. Sjogren's shows dry eyes and mouth, parotid swelling, and dental caries. Mixed connective tissue disease presents with mixed features of lupus, systemic sclerosis, and myositis with anti-U1 RNP positivity.